Hi there, and thank you again to the Voice Foundation for allowing me to present the results of our research at this 49th annual online Voice Foundation Symposium, Care of the Professional Voice. Today I'd like to present to you the results of a study we've undertaken looking at the impact of student rating preferences using an online auditory perceptual training tool. I'd like to acknowledge my co-authors, Ayin Huzmeli and Dr. Duong Nguyen. We're based in the Faculty of Medicine and Health at the University of Sydney and supported by the Dr. Liang Voice Program. So auditory perceptual judgments are the most common form of voice assessment and considered the gold standard. They make up a core clinical competency of all speech pathology graduates in Australia. And we know that brief periods of training with feedback has proven to increase the reliability of judgments, as is using an auditory comparison or anchor. There are many factors that influence auditory perceptual judgments, including the amount of experience we've had rating voice disorders, and that is the development of an internal standard. Experienced raters tend to have good intra-judge reliability and poor inter-judge reliability, and vice versa for naive students. External synthetic anchors have been demonstrated to assist and increase reliability. Comparison judgments versus isolated judgments have been demonstrated as being more reliable. Task can have an effect. For example, vowels have been rated more severely than connected speech samples. Rating multiple dimensions can change the way that we rate and the severity with which we rate different voice qualities, as previous ratings can influence subsequent ratings. Provision of definitions for the voice quality terms that we are rating has proven to have a big impact on the consistency of our rating, and training has been demonstrated as improving auditory perceptual rating reliability. Research conducted in the Dr. Liang Voice Program at the University of Sydney has also revealed that there are other factors that can affect online auditory perceptual ratings. So, for example, we found that providing an online platform to do auditory perceptual ratings increased the amount of practice that students undertook. The students that practiced more performed better on assessment tasks. Students performed better generally using an online tool versus a paper-based tool. And students rated features as more severe the more times they rated the auditory sample. We also found, though, that experts and naive student listeners rated the same without training, except for ratings of strain. And again, strain was an outlier when we looked at the provision of exemplars, which assisted student learning in the rating of other voice quality features other than strain. But currently there's no research on when listeners should rate audio samples. So this was our research question, and we wanted to find out that if the timing of auditory perceptual rating had any effect on rating outcomes. So we used our online rating platform, Bridge to Practice. This is a free platform developed by the University of Sydney and supported by the Dr. Liang Voice Program. And we developed a CAPE V rating form on the platform and subsequently uploaded a range of different voice samples of people with voice disorders. The platform allows for the student to play the sample as many times as he or she likes. This has been sped up. You can see that the actual rating task has now been completed, and then the student presses submit, and then they see the expert raters' responses. So our research questions were, is there an effect of speech pathology students' listening rating patterns on auditory perceptual rating scores using this online version of the CAPE V and using specific tasks? That is the four you can see on the screen: overall severity, roughness, breathiness and strain. We did not investigate measurement of the alternative features on the form. 122 undergraduate and master speech pathology students were recruited over a 2-year period. 20 audio recording samples of people with voice disorders were provided to them, and this resulted in 1,735 individual auditory perceptual ratings that we analysed. We analysed the mean number of times a recording was played and how often it was paused by the student. And we also analysed the auditory perceptual rating scores of overall severity, roughness, breathiness and strain. Now, strangely enough, there were actually some people who somehow completed a rating without even listening to the media sample. So we actually excluded those people for obvious reasons. The remaining 1,670 ratings were divided into 4 listening rating group patterns. In the red, we have ratings that were only completed at the end of the audio sample. So people finished listening to the whole audio and then rated it. In grey, we have the group that did ratings while they listened to the audio sample. So while it was playing, they're making their ratings, but they also rated at the end of the audio sample. But at no point did they click to pause the audio and rate. In green, these people rated only while listening to the audio, and there was no pausing the audio or rating at the end. In yellow, the audio was paused repeatedly to make ratings. So most samples were rated while people were listening to the audio without pausing, and very few samples were rated just at the end or while pausing. And I would just invite you to take a moment to think, through those of you who work in clinical practice, which of these 4 groups would you fit into? I would suspect from my own clinical experience that I would fit into the green group also. So you can see that we've only analysed the rating effects of these 4 quality parameters, but one-way analysis of variance showed significant main effects for them. So let's go through these in a little bit of detail. We analysed the mean ratings of the different qualities, how severe people rated these qualities, and whether these changed depending on the listening rating pattern used. We can see that for the overall severity and roughness qualities, samples that were rated as more severe on average by the listener these listeners were making ratings while pausing the audio sample. These qualities were also rated as less severe if the listener made ratings while listening to the audio and at the end with no pauses. Now the effect is slightly different for breathiness and strain qualities. These were rated as more severe if the listener rated the audio only while they were listening to it. That is, there was no rating at the end of the audio sample, nor was the audio sample paused. What's consistent again here, though, is that these qualities were rated as less severe if the listener made ratings while listening to the audio and at the end, with no pauses, as you can see with the grey. Given that the different effects on rating that we observed, depending on whether the audio was paused or not while rating, we looked at whether there was a correlation between the number of ratings made when the audio was paused. And what we found was that there was a significant correlation between the number of ratings and actions while the media was paused and mean ratings of roughness. So the more rating actions, the higher the score. But this was only significant for ratings of roughness. We also looked at correlations between the number of times the media was paused and mean auditory perceptual rating scores. And what we found was that there was a significant correlation with the number of times raters ended or paused the media to make a rating for their mean ratings of breathiness and strain. The less they paused the audio sample and it rated at the end of the audio, so the group in the green, the more severe they rated breathiness and strain. So in summary, it would appear from the data that the way we listen and rate audio samples does have an effect on our auditory perceptual judgments when using an online rating platform. Most students tended to rate the audio samples while they were listening to it and make ratings after they'd finished listening to it. Now, it's not clear yet whether this means they're changing the initial ratings and judgments they're making at the end or not. When an audio is paused, when the audio sample is paused, judgments of overall strain and roughness were more severe, but we don't see this for breathiness and strain. When the rater was rating while listening to the audio, so no pausing, no ratings at the end or making changes, they perceived breathiness and strain as more severe. Now, our reasons for all of this are at this time fairly speculative. It may be that pausing the audio recording or just waiting till the end to make a judgment is actually having a significant effect on the psychoacoustic process that's occurring when people make judgments. If we only listen to the first few seconds of an audio sample, we're going to make judgments for as long as we're listening for. So there may be an averaging process going on over the course of listening to the entire sample. And this obviously will mean that ratings may change over time. So people who rate the audio only while they're listening to it may be making more of a definitive judgment rather than those that rate while they pause and then re-rate again. So we have to look at the data in more detail to see if we can find whether this explanation is valid or plausible. It also seems that we rate or perceive the various voice features differently, and we don't really understand clearly why this is, given the data that we've seen here. There may be some perceptual voice features that require more time for students to judge or compare to their own internal anchor. Maybe pausing the audio sample and giving time to compare to the internal anchor makes the judgment more of a confident judgment, so that they're perceiving roughness as more severe. But we didn't see the same effect across other features. Maybe the perception of roughness is confounding perceptions of breathiness, because this has certainly been documented in previous literature. It might be an order effect in the way that the form is ordered, and so that listeners are attending to specific parameters sequentially, which also may impact their rating. So the implications of our research are clear. Clearly, listening patterns have a significant impact on auditory perceptual judgment, and the effects differ across voice qualities. So we really now need to think very carefully about developing some recommendations for when people listen and rate. So, for example, how many times that they listen to a sample and when they rate the sample in that listening sequence. Now, this research has been conducted in the context of student rating and a learning environment where the students were able to rate as many times as they liked, and they weren't necessarily marked on their practice. What we don't know is whether the rating patterns we've seen in students are also valid for clinicians. So we now need to look at investigating speech-language pathologists, listening preferences and rating preferences to see if in fact we see the same factors. Thank you very much.